The problem is when we talk about meetings like ASCO, the knowledge is increasing and the number of data is increasing tremendously. And it's really difficult to catch up with the improvement in knowledge that we are seeing or that we have seen in the last years. And I think when I started in thoracic oncology, we had this ASCO meeting once a year, and then there was I would say, limited amount of new information for treatment of lung cancer. Now we have meetings in thoracic oncology nearly every 3 months globally, and it's nearly impossible to be present on each of these meetings. So I think that there is a great future also for virtual meetings. It's, I think, one of the few opportunities for doctors who are really in daily business with patients with oncological diseases to keep with the increase of information, to have access to the information. And what we also do see is the problem that a lot of colleagues are getting to be able to travel across the continents, to get the sponsoring, to get the funding for all this travel. So I personally do believe that the virtual meetings are going to complement the presence meetings. Still, we need the live discussions. Still, we need the exchange. But these virtual meetings are going to be complementary to this presence meetings, to the presence congresses. And here in Germany, what we do have is also a very broad approach to cover the ASCO, to cover all tumor entities which are part of the ASCO in a program over the weekend. So we have a number of tracks where we are discussing in parallel each tumor disease, the current presented data of the ASCO abstracts, but we also have the opportunity to reflect the content of the abstracts, the impact on our daily life in discussion rounds. And this is also one of the advantages of the virtual meetings, that you might ask some of the experts really to digest the data, to reflect his opinion on the impact of the data, because we also have to realize that the number of abstracts is going up and up and up, and we really have to sort out the really essential one for our clinical practice. Therefore, I think virtual meetings has become a great new opportunities to take part into the improvement of knowledge.